Qualitative findings. There were 5 or 6 themes. I'll go through these briefly with you. First, the partnership with the translator was very important. Understanding the need for a translator, and also making sure that when you work with a translator, the translator only does translation. They don't form the therapeutic alliance with the parent. That can happen. That's a risk of having a translator. They have to stay neutral. They can't take that away from the interventionist. So if you have translators, the parent could bond with the translator because they're speaking the common language. You can't let that happen. You got to talk about that up front so the translator knows they have to always shift back to the interventionist when they're doing translation. So the bond, the therapeutic alliance is with the interventionist, not with the translator. That's important. Important insight. Also, the importance of developing a therapeutic alliance. Cultivating the ingredients of a therapeutic alliance. This is the term that comes out of literature. Everyone who's a behavior analyst, I encourage you to Google therapeutic alliance and read the vast literature out of clinical psychology on the importance of developing a therapeutic alliance. It accounts for 40 to 60% of the variance in parent training success. If you don't know about this, it's going to be harder for you to do the work. It includes building trust, communicating respect, giving hope and building hope, showing gratitude, being compassionate when parents struggle and make mistakes along the way, and always open communication. Those are some of the ingredients of therapeutic alliance that Catherine discovered through a qualitative analysis. Maintaining parent-professional equality, not putting yourself above the parents, but always working in partnership. And that's a struggle for us because we think we might know something, so that makes us better. It doesn't make us better. It gives us responsibility to share what we know so we can empower parents with that knowledge. Family members assuming the role of cultural liaison. In this case, the father was the cultural liaison when particularly when the translator left. She actually left BC. The father took on the role of being the cultural liaison because his English was much, much better than the mother's. Also, understanding and accepting shared and divergent cultural perspectives. This is really important because although we wanted to understand Taiwanese culture and how it informed the family, we also know that this family moved to Canada and they're also developing Canadian values from year to year. And so we want to understand that so it's not to pigeonhole or stereotype the family. One has to look at every family individually and relearn what it means to be culturally responsive. That includes recognizing shared and divergent cultural perspectives, not just this versus that, but there's an integration along the way that parents have, and they begin to adopt Canadian values along with, in this case, Taiwanese values. Identifying and rectifying errors and barriers. Catherine, ever since she was a teenager, had a mindfulness practice because she was actually a competitive ice skater and very good at it at the national level. So she had this mindfulness practice, and so she had this concept of the beginner's mind. Every time I go to the family, I'm going to enter with a fresh beginner's mind. I'm going to let any other thoughts I have interfere with me understanding this moment, this work now with the family. And she saw that as a very important part of the work. Persevering to gain deeper levels of knowledge. As we've struggled in some of the early challenges, both with the child and with the family in terms of the process of change, Catherine, with great calmness and respect, continued to strive to overcome those issues and succeeded. And also very reflective on her own error patterns and ready to apologize or repair anything she did that might not have been culturally sensitive. Because one learns along the way. One isn't perfect when one starts in this regard. Also, continue reflecting, developing knowledge of, and taking steps toward cultural responsive. What Catherine did was she was mindful in this way. She contemplated this thought every day with the family. How am I going to be culturally responsive today? How was I culturally responsive, or how was I not? And by answering this question in a contemplative way every day in her work with his family, she gradually learned to be more and more culturally responsive because she was attentive to all those opportunities, or attentive to when what she did was discrepant from that intention. She held this intention, she showed deep awareness every moment, and gradually trained herself in this way to be culturally responsive. That was a qualitative finding. And this is really important for everyone. All of this is important, but this is a really interesting finding too. Professional competence is really, really important. What Catherine did was she integrated different theoretical frameworks and practices that derive from them. Behavioral theory was distributed all through her notes. The importance of functional assessment, the importance of understanding the function of behavior, the importance of understanding coercive patterns of interaction between the parent and child, understanding the power of the activity setting as a routine of analysis and intervention, which we've learned, which comes from ecocultural theory, understanding the literature on Therapeutic Alliance, because the students who work with me learn about that, whether they want to or not, and really working on developing that Therapeutic Alliance, knowing what it looks like, because she's read the literature, she's been exposed to that level of knowledge beyond just her profound knowledge of applied behavior analysis. She's an amazing applied behavior analyst. And also cognitive behavior therapy. We had to do some cognitive restructuring, and Dr. Ishu Ishiyama guided us through that. How do you work with a family in a culture-responsive way that includes allowing them to adopt some Western science-based thinking about parenting your child? Does that make sense? Here's the thing. The laws of behavior apply to everyone. They don't discriminate by culture, right? So if one doesn't praise a child and they need praise, although not praising a child might be culturally consistent, it doesn't make the parent effective. And so we have to help parents adopt Western science-based knowledge on parenting, as we also respect and work on integrating all of this into their culture. That's being culture responsive. Culture responsive is saying, well, your culture doesn't believe in praise. Well, that's off the table, right? I don't think so, because as behavior analysts, we know we have to contingently reinforce desired behavior, and the most powerful, most portable form of reinforcement is social reinforcement, right? You can bring it everywhere, like a wink, a smile, a hug, right? A kind word. And the parents learn that, and they learn to love it as well.